Hello, welcome back to MPharm Training Solutions. Today I'll be discussing the essential drug concept, the drug management cycle, and selection of drug. Now, because according to WHO, essential medicines are those medicines which satisfy the healthcare needs of majority of the population. Of course, they have to be an affordable price by the patient or the community, and available in adequate amounts and in appropriate dosage form. Of course, now we know that essential medicine concept. This is a public health principle that promotes efficient use of resources. Remember, all resources are not enough, but if you have a limited list, you can manage your resources very well by using a carefully selected list. Now, in class, when you're teaching you pharmacology, we teach you vast drugs, very many drugs. But when you come to practice, vast majority of healthcare problems can be managed with a carefully selected list of medicine. This one we know it. And of course, in practice, the physician and other healthcare professionals routinely use fewer than 200 drugs. This is of course we know. And why? Because these are the ones which can be used mostly. So imagine if you focused all the training and the clinical experience in those ones, what will happen to the practice of medicine, of health? Now, which criteria do we use for selection of medicine? Of course, pattern of prevalent diseases, quality of drug, safety profile. Do we have the PK pharmacodynamic profile of the drug? If there's a performance in the variety of settings, favorable cost benefit ratio. Of course, drug should be affordable by everyone. Possibility for local manufacture, availability of human resources to use the drug, because don't select drugs which can be used by your workers you have in your facility, because you'll be wasting time. Now, what are the benefits of having a limited list of essential medicines? Of course, there is easier drug management, more cost effective. Of course, there will be some competition. However, this one is questionable. Improved training of health workers is the identification of ADR, adverse drug reaction. Focused drug information, reduced confusion because of a limited list, and sometimes the estimation of local production. Now, however, there are some limitations. It can create monopoly, and some patients may be required drugs which are not on the essential list of Uganda, for example. But however, there is here where NDA, National Drug Authority, can grant special import permit for such drugs in order to save the life of the patient. Now, we have the essential medicines of Uganda. It is called the Essential Medicines and Health Supply List of Uganda. I think the latest edition is 2016. And I have the UCG here. It is at the end in Appendix 3 of the UCG. I don't know if you know it. Yes. Starting from page 1035. It is there, Appendix 3. We also have the formulary. This contains some of drug information. It is a handy reference. Every professional should have it. We have it can contain the generic name, the use, the dosage form, the schedule, the contraindication, side effects, and all those other drug information. Form of monographs. I also have a copy. I don't know if you have all these copies. We have the practical guidelines for dispensing at higher health center level 2015, and of course the common on which we use are the BNF plus most of the apps which you have on your phones, which can also be used as drug manuals. Also have the standard treatment guidelines. We know it, the UCG. At the page on the cover page, it is saying national guidelines for management of common conditions. So it gives you the disease and the preferred drug according to our treatment guidelines. However, let me talk about the personal drug concept. This one is very important. Personal P drugs are those drugs that are being chosen by health professionals for use and dispensed regularly, because they become familiar with them. Of course, you have to know the name and all the information, the dosage form, schedule, and duration. So we know it. We just practice it, but we just know it that when you're suffering from this, you go for this. And of course, there are always priority for a given indication or a patient complaint. And however, this one can vary from one profession to another. And always choose your own P drugs. They should not be imposed on you by senior colleagues, sales representatives. This one is the common one. These marketeers, they come and anyway, I may not talk much. Because the most expensive one is not always the one which is good. And the latest one is not always effective. Sometimes they may be effective, but not always. And it is necessary to remember, and also you're responsible for your action. Don't say that you dispense this drug, this guy told me. No, you're responsible for your own action. Let's look at the drug management cycle. This is a common question, even in interviews, in whatever. Of course, those who have attended, they always ask these questions. Now, this illustrates the steps in the medicine and health supply cycle. Because they include selection. Selection, let me first enlarge it. Selection. From selection, we have quantification, procurement, ordering, storage, and distribution, and then diagnosis and use, and then the cycle repeats. However, in the middle, you have the support systems. Support system, we are having the adequate human resource. We are also having sustainable financing, the legal framework, all the laws, monitoring and evaluation. This one is very important, and the IT systems, because you can't manage all these without IT systems. In the government has the RX solution. I don't know if it is. Now, selection of medicines and health supply. Because this is a process of identifying and picking out the required medicines for use at a given facility. Of course, it will ensure that your supply. This issue of this of course will improve quality of care for patients. This issue of writing OS, and in a community pharmacy, patients will not come back. Of course, in selection we use the generic name or the IAN name, the official name, not the brand names. Why? Because they are more informative. It's also required by the law, used to identify the class of drug, facilitates product substitution. Because if someone said the paracetamol, if you have Camado, Renado, you can give those ones. Easier to memorize, and of course, sometimes competition could lead to cheaper prices if you are used generic. But if you say brand, it is a brand. A brand is a brand. Which tools are used in drug selection? Those, as mentioned above, the HMLSU list, this one, the UCG, the formula, but the common one which you have to use, it has to be based on your consumption records, because if you are consuming a product more, you have to buy, you should select it more often. Now, which tools are used in prioritization? All of us know the Venn, ABC, and therapeutic category analysis. Let's look at Venn. Now, V means vital. Of course, these are drugs which are life-saving, and in case they are not around, they can cause serious harm, even death or irreparable damage. Now, however, it's not always about drugs. Even health supplies like gloves. Gloves are vital in the hospital. Syringes, cannula, those things are vital, because without them, there's no way you will administer life-saving drugs. And others. Essential, these ones are used in management of common conditions or less severe illnesses, but because they are not around, the patient will have some pain and discomfort, but he will survive. The non-essential, these ones are used for minor self-limiting illnesses. However, some drugs can be non-essential and vital. The common one which we all know is paracetamol. Of course, Venn is used in prioritizing and drug selection, in procurement, adjusting budget. I hope you know that calculation. In case you don't know the calculation, you can always contact us. We can guide you and explain to you. ABC, now ABC, it uses consumption data and money. Now you can realize that those drugs used commonly in the pharmacy, and they're between 10 to 15%. They're highly consumed items. So which means that when you're going to buy, when you're procuring drugs, they have to take majority of the budget. Even the drug is non-essential, but it is moving very fast. This is based on money and what? And consumption data. Cost category B, this one's 25 items, and then of course they take at least 20% of the budget. However, there are those items which move once in 2 weeks, once in a month. Always they are maybe the majority, but you should not buy them in large quantities. Like for you go to buy class items and you buy more, so you'll be doing the service. Now, these percentages, of course, can vary depending on the facility you are in. They can vary. Now, this has been a short presentation on essential medicine concepts, drug management cycle, and of course the section of medicines. These are the other ones which we have. You can refer to them. Can always refer to them. I always remain Wilson from M Pharma Training Solutions. Subscribe to our channel in case you haven't subscribed. Click on that subscribe button, log into YouTube. Contact us, we shall always reply. Leave a comment, give us a thumbs up in case we have done some work, or you can send us a comment on how to improve and bring you better quality work. Thank you very much.